Hi guys, welcome to Angolra, Hangolva. I'm Tünde, and today we will deal with a new topic. Actually, it's gonna be at the doctor. I do hope you are not sick or ill too often, but it's better safe than sorry. So let's learn the most typical questions and phrases that you can hear from a doctor. Here is the first one. Let's suppose you have to go to a GP, and the very first question you might get from a doctor will be this: what's the matter? Or in American English, what's the matter? So what's the matter, or what's the problem? What's the issue? What's the trouble? These are all alternatives for asking you about the issue. The next one that you can hear is this one. Do you have any pain? Do you have any pain? Or does it hurt when I press it here or here? You know the joke. All right, the doctor can ask you, what do you complain of? Or what are the symptoms? Or what are your symptoms? After that, the doctor can ask you, can I take a look at your throat, for example, or other parts of your body? But he can also use the term to take a look at or have a look at. Both are correct. All right, let's suppose he wants to examine you, and these will be the next typical sentences from him. Let me listen to your heart. This is your heart here. Let me listen to your heart. Or let me sound your lungs. Or let me take your blood pressure. Let me take your temperature. So these are all typical phrases at the GP. He can also ask you, open your mouth, please. Or he can ask you, how long have you been ill or sick? By the way, do you know the difference between ill and sick? Sick means when you don't have a serious problem, you rather feel bad or you have to puke, so vomit. And this is the case when you're sick. But being ill is much more serious. So when you have a disease or serious problems in your body. Right. So how long have you been ill or how long have you been sick is another typical question. As the part of the examination, the doctor can ask you, take a deep breath. I've just taken a deep breath. Okay, or he can ask you to take off your shirt, take off your t-shirt because he wants to listen to your heart or examine you. Or he can tell you, I'm going to prescribe some medicine or pills. Okay, what's the next one? If you're in serious trouble and you're really, really ill, then he might put you on the sick leave and tell you, you must be on the sick leave until, and he will tell you a date. He might ask you if you have any allergies. So, do you have any allergies? Or send you to a specialist. He might tell you that you need to take a urine test or a blood test. Obviously, these are different things. Blood test, the blood is in your veins, and the urine when you go to the toilet and you pee. Okay, let's see another typical sentence from a GP or a doctor. He might tell you that you will need a blood test. So, which is quite similar to the previous phrase. So, blood test when you're testing your blood and try to check for problems. It can also happen that he will give you an injection. In this case, he will tell you that I will have to give you an injection. Don't be afraid of injections. Injections are this. It's not really painful, so don't be afraid. Right, guys, I hope you won't have to go to the doctor, but just in case, it's good to know these phrases and these questions. If you're a Hungarian person, you will find the translations of these sentences below, and you can find the equivalent in this case to help you with the learning process. Don't forget to practice them, because in the next episode, I'm going to give you those typical phrases and sentences that you will need as a patient to describe your problems and your symptoms. Thanks for your attention. See you in the next part. Bye.